best thing about being a GP is the variety. Every single patient is different. Feeling a bit better? Ooh.
The hardest thing is the intensity of the workload, to be able to do things the way you'd want to do them in the time that you have. I still think this is nothing to worry about, but there is a very, very rare condition that is more urgent that we get it seen.
I never come to work and think this is going to be a boring day, because no matter what happens, it's never the same.
I've dislocated my finger.
Were you trying to relocate
Yes,
it yourself?
So with those urgent referrals, they are referred on what's called a cancer 2-week wait referral. It just means that anyone that we're worried about with an unusual lesion, we want to see within 2 weeks' time.
Farnham Road Surgery, how can I help?
Sarah Brookman.
Oh,
Sarah. Hi, come
Hello, mate. How you doing?
I'm well. Thank you for waiting. Sorry about the delay.
That's okay.
How can I help today, Sarah?
I found out I'm pregnant.
Oh, wow. Congratulations.
Thank you.
Okay. So this is the first appointment that you've come in for.
Yeah.
So you are baby's dad.
Yeah,
I have to ask. I Let's see. Okay. When was your last period?
The 6th of May.
6th May 16. When did you do the pregnancy test?
2 days ago.
That's positive. Lovely. So.
You're very soft-spoken, you know that. You're very like.
Is that a good thing?
That's a good thing.
I'm saying the 21st of February next year.
Okay, should we check?
Yeah, go for it. I want to bet on this.
Better fiber. Doctor's right.
Yeah. Okay, it says here the 10th of February.
Oh, damn it.
Don't worry.
I was that close.
And you are exactly 6 weeks today. 6
Wow.
weeks. Okay, and
That explains a lot. I'm taking pain.
have you ever been pregnant before?
Yeah, I've got 3 children.
You've got 3 children. Any other pregnancies apart from the 3 children?
Yeah, I've had a miscarriage.
Okay.
I had that last year.
Any?
At Christmas. No, not last year, the year before, 2014.
Okay. So, this is the form that you need to take with you when you go for your scan, okay? Otherwise they won't do the scan, so it's really important to keep this one safe. Give them a call, and like I said, book the appointment for 12 weeks, so that's in 6 weeks from now. Book an appointment now with the midwife for your 8 to 10 weeks, so 2 to 4 weeks from now, and book an appointment for your blood test.
Brilliant.
And congratulations.
Thank you very much.
The only other thing I wanted to mention is there's lots of information about things that you can and can't eat in pregnancy. I'm sure you've had it all before.
No, don't worry. I've already been into the calf like, oh my God, I can't eat runny egg.
Yeah. But I can, so...
No, he can't. No.
Absolutely.
Brilliant.
Lovely. All right, then, guys.
Thanks very much.
Lovely to meet you.
Cheers.
All right, bye-bye now. Lovely to
Take
meet
it
you.
easy. See you later.
Bye-bye now.
Positive, mate.
In we come. Come and take a seat. How are we getting on?
I'm here for
The other injection.
the other injection.
How did the first one go?
Okay, it's been easier
That's
to move.
steroid is a fantastic drug, but it can have short-term and long-term effects.
Yeah.
What does it actually do?
It's the best anti-inflammatory that we have. Really, it's better than all of those things like Nurophens and all the tablets you can take, which are anti-inflammatories. But this is a steroid type anti-inflammatory. The other ones are non-steroidal anti-inflammatories, and it's a fantastic drug. Except long-term use can cause lots of problems, including diabetes. Strangely, you can actually turn somebody into a form of diabetes with it. So I'm pleased that it helped.
Yes.
And you're happy for me to
Yes,
have another go?
Yes.
Fantastic.
Brilliant.
Good. I'll get it ready.
You're great, yeah.
Well, I hope this one's as effective as the last one. Prick now. Are we ready? All done.
Okay.
Brilliant.
You're right. You can breathe again now. Well, you came up saying she was short of breath, and now she stopped breathing altogether. Very good. Okay. You can't do too many of these, as in, you can only do 2 per shoulder per year.
Right.
Okay, so it's a matter of waiting and seeing how that goes now.
Okay. Thank you very
Lovely.
much.
Well done.
Good to see you too.
Thank
Let me
you.
get this door.
Good night.
Thanks very much.
Always good.
All the best.
See you later.
Bye.
Cheers. Bye-bye.
You okay, my love?
I rang up this morning, prescription, Mr. Bronivisky. I mean, I got a new hip, a new back, I need a new eye, a new nose, and new teeth.
Yeah, I'm a bit like that.
Well, bionic.
Hello.
Okay, so I understand we're worried about the left eye, is that right?
Yeah, but in the night time, it's very visible. But the daytime, when you try to see it, it's not very visible.
Where do you notice it?
It's a pupil, the white spot on the pupil, left hand.
Have you got a picture?
Yeah. Easily you can see it.
Yeah, I see what you mean. Let's have a look. So it's on the left that you're noticing?
Yeah, left, yeah.
Yeah, I think I see. It might, but not necessarily, be that you can get something called a congenital cataracts.
All right.
So they get like a whiteness, which I think is what you're seeing when you're taking that picture.
Yeah.
So I'm going to write a referral.
Oh, all
So
right.
you should get something in the post.
Okay,
At
from
the
the eye specialist.
From the eye specialist, yeah.
All right.
And at the moment, I don't think we need to do anything else other than to get them to check it.
All right.
I don't think it's going to cause any problems right now.
Okay.
Okay, so
Yeah, we just worry about
yeah,
it.
which I can understand. Yeah,
Yeah.
of course. Yeah, and the thing is, every time you're seeing it at night when you're checking the photos.
Nighttime is you can see easily and
Yeah.
it seems like bigger.
Yeah, and otherwise we'll check again in 2 weeks' time anyway because you'll have the appointment for the 8-week check. So we can always re-review it at that stage.
Yeah, because 8 weeks we're coming back.
Yes,
so-
exactly, to do the normal stuff and the immunisations and things.
Yes. Thank you very much.
No problem. Okay,
Bye.
take care. Sam. Initially, I thought this was going to be a routine referral, but there were a few factors that made me worry about the patient, even whilst I was initially consulting, which made me think actually I should look into this a bit more. Have a look at this. The way it presented was a bit different, and it made me wonder whether this could be something more serious and rare, like a retinoblastoma. Oh, hi there, it's Mustafa here. Hi, I've just seen a patient, Hussein Khan. It's a 6-week-old. I'm just wondering if the parents are still in the waiting room because I think they were going to get him changed. I just wanted to speak to them again. Retinoblastoma is a malignant cancer of the retinal cells of the eye. If it goes undetected, ultimately it can be life-threatening. Oh, actually, it's okay. Halima's going to go down and have a look for me. Thank you, bye. Oh, hi there. Are you able to put me through to the eye casualty? Oh, hi there. This is Dr. Suranji calling from Farnham Road Surgery. I'm just calling about a patient called Hussein Khan who I'll be sending to the eye casualty tomorrow with a letter. Thanks, bye. Sorry, I know you've gone and I've told you that, don't worry about it. But the thing that you said about the photo and noticing it in the dark night, it made me think about something. I still think this is nothing to worry about, but there is a very, very rare condition that is more urgent that we get it seen. So what I think I'm going to do is I'm going to write a letter for you to take to the eye casualty tomorrow.
Okay.
Okay? I still think it's nothing to worry about. I still think it's going to be something that is, even if there is a problem, they'll be able to deal with routinely. But there's just this one rare thing that can present with this thing about being more noticeable in the dim light. So I just want to double check on that. So I'm going to write that letter now. I'm going to give it to you in an envelope. So King Edward VII Hospital. So you go there, you fasten where the eye casualty is. Okay. Awesome. Okay, bye.
I got my cough back again. And it's annoying because it won't let me sleep.
I feel like I've got phlegm stuck across the back.
Chesty cough.
Productive.
What do you mean productive?
Coughing stuff up.
Oh, yeah.
I can't get it up, that's the problem. It's sort of here.
Oh, yeah, I can hear it.
Just like stuck.
Take some deep breaths in and out, please.
In.
I can hear it on this side, left side.
Benjamin Pulsford. Hello there. It's Dr. Hyder. Come here and have a seat. All right, so you had a chest infection recently, didn't you? Yeah. How are you feeling? Is it
good, actually? I feel like the antibiotics are working. I haven't coughed badly in a while. I still cough every now and again, but last time I took all the antibiotics and I still felt a little bit of pain, and they said it was normal, and then it came back.
Right. Okay, all right. So things have got a bit better, but you're a bit worried that you're coming to the end of them because you don't want it to come back.
Exactly.
So they found this, like a cavity lesion with infection in it in the right middle part of the lung.
Yeah.
And it had increased in size and there was like a fluid air level, so it looked like consolidation or infection. So because there can be a chance of this being something like TB, they recommend an urgent referral for you to see the specialist. A lot of people might think that TB doesn't exist in the UK anymore, but in fact it had never been eradicated, and it's only in the last 5 years that numbers overall have started to decline. So with those urgent referrals, they are referred on what's called a cancer 2-week wait referral. It just means that anyone that we're worried about with a lung unusual lesion, we want to see within 2 weeks' time to do further investigations. And you're very young, so I think it's unlikely to be something like cancer, but we need to make sure that it's not something like TB. Have you been exposed to anyone that's had TB?
None I know of.
We give babies and young children the BCG vaccination if we think they're living in an area where there might be an increased risk of catching TB. TB is more prevalent in areas where there's social deprivation, and it's important if you have any symptoms such as a cough, night sweats, weight loss, that you do see your GP, especially if you think you've been exposed to someone else that may have TB. Maybe that this is more of a complicated infection, like a pneumonia, that you feel a bit better from now, but we don't want to leave it alone because it's the second time it's happened, isn't it? So we want to get you referred. So it's a bit of an unusual chest infection that's been a bit resistant. The antibiotics you think are working.
Definitely working.
Yeah, I think I'll give you an extra week so you're not, at risk of getting unwell in the meantime or waiting for your appointment.
So I need to make another appointment or not?
Well, it'd be good to see you after you've seen the specialist in 2 weeks to find out what's happening. If you're worse before then pop in sooner.
Thank you very much.
Take care then. Bye-bye. Hello.
Hello, I'm coming to claim my prize.
Oh, let's have a look. It's a big teddy.
Yeah. Oh, I should have brought a bigger bag.
Yeah.
Hi, come on in. How are you? How can I help?
For the last 2 weeks, I've kind of not been feeling right. I've been feeling really tired and drained and just bloated all the time and constantly going to the toilet. I had a miscarriage in February, but I don't think it came out. So about 12 weeks ago, I had a D&C and a laparoscopy.
Right.
And they removed something. Still not come on my period. Literally in the last few weeks, I could be sitting there and I'll just fall asleep, and that's not like me. I've got a 4-year-old, but I'm not doing anything over excessive or anything like that. And I don't know, I just don't feel right.
Have you lost any weight or anything?
In the last year, I lost quite a bit of weight, and everyone kept saying, oh, where have your legs gone? Where have your boobs gone? Where, you're just shrinking. But now, it just feels like I'll eat something and my belly feels like it's out here.
Do you think your weight loss is related to your mood?
Not really. I'm quite a happy, positive person.
And what about your sleep? Is your sleep okay?
When I sleep okay. Living with my mum, my daughter sleeps in my bed. The flat isn't big enough for her to have her own room.
And what do you do for you? What sort of things? Is there any you time? Do you get any time?
Not really.
No. Is that because they're a little girl?
Yeah. Okay. Occasionally, maybe of an evening, my mum will have her and I'll go and stay at my boyfriend's.
Is there any depression in your family at all?
My mum suffered from depression. She was off work for quite a while with depression and anxiety.
Do you feel depressed, do you think, now?
No, I don't feel depressed.
So how tall are you?
About 5'6".
So your BMI is just sort of 17 and a half, so that's underweight. It's quite difficult to get into this underweight category, actually, so that's quite significant. I think, you know, a lot of your symptoms are due to the way you're feeling psychologically, but they do have an effect on the way your body works and the way you feel about your body as well. So if you're feeling stressed and tired or feeling depressed, then it can make your body functions feel different, and you can have abdominal symptoms, you can have all sorts of other things that you might, if you're anxious, you might get fast heart rate, that sort of thing. So the mind has a big effect on how we feel about our body and how we feel it's working. What I want you to do is just do a urine sample. But we should just do a couple of blood tests. Probably the most important one to do is the full blood count to make sure you're not anemic or nutritionally lacking in anything, and the thyroid test, because if your thyroid gland overworks, you can lose weight. And then if we bring you back next week with these results, it'd be nice to catch up and we can go through that. Okay.
Thank
All
you.
right. Okay.
Just when I cough, my chest been pretty hurting along with walking as well.
Now the chest pain, tell me about the pain. Is it a sharp pain when you're coughing?
Sharp pain is literally centralised smack bang in the centre of my chest. It's just like, feels like a bang across my chest, really tight.
Okay.
Because I've had heart problems before.
What heart trouble have you had?
It's swollen ventricles.
Any sweating, nausea, vomiting, dizziness associated with the chest pain?
It's when I cough, I get a bit dizzy, and apart from that, it's just constant coughing, just chest pains, and it's restricted breathing, really.
Okay. Jump over here for me. Let's check. Arm like this for me. Okay, now, I'm just going to have a listen to your heart, if that's okay.
Yes.
And take some nice big breaths in and out. And again. And again. Okay, come and grab a seat for me. Now, I mean, there's very good things. So the good things are, your temperature's perfect, your oxygen levels are perfect, your heart rate is perfect. However, the thing that concerns me is when anyone gets a tight pain on the chest, we need to make sure this is not related to the heart. Does that make sense, okay?
Yeah.
And the best way to do that is by getting a blood test done. That really should be done at the hospital because, of course, if that comes back as abnormal, then they need to action and make sure that there's nothing else worrying going on. Does that make sense? So I think that's what we should do today. I think we should get that done today, okay?
I'll have to swim past work first, though.
You should go there now,
Okay.
all right? You don't need to worry about work because if you do suddenly develop, tight chest pain, you feel like you can't breathe, you're sweating, nausea, vomiting, dizziness, then that could be the heart. You call 999, you get yourself to hospital via an ambulance. Does that make sense? Take that straight up to A&E reception. When you go up to them, just mention that you've been sent by your GP for chest pain.
That's fine.
All right, buddy? No trouble. And make sure you go straight there now. Okay?
Mr. Tagala, please. I've got a medical student with me today, if that's okay. I'm Dr. Tawana. Nice to see you. So I think you spoke to one of my colleagues, something about bleeding from the back passage.
Yeah, that's right.
Tell me a bit more about what's been happening.
Well, I had a bit of constipation about 6 days ago.
Yes.
So after that, started bleeding.
Yes.
I really.
So with the constipation, let's just double check. Were you really struggling to pass the stool?
I did.
Okay, and then after that, that's when the bleeding started.
That's right.
Okay, talk us through then the bleeding. Then how's that been happening?
It was like spray.
Oh gosh. Okay. Into the bowl.
Yeah. Bright red.
Okay.
Blood sort of thing.
Sure. And has there been any pain from the back passage at all? And when did it start?
It started on Thursday, I think.
Thursday.
Thursday.
Okay, Thursday, Friday, Saturday, Sunday, Monday, Tuesday. So 6 days now.
Yeah.
It sounds like, just from your description, the main problem here has been constipation. And as a very hard poo has been passing through and you're trying to push and squeeze, it's caused a tear, probably.
That's what I thought.
Not serious. Normally does settle by itself, but we need to examine you, if that's okay. So that does mean popping finger into the back passage, checking around. We're going to be looking for piles, anything else internally, checking for any obvious blood. And just give me a shout when you're ready.
Yes, I'm ready.
You're ready? OK, just bear with me. I'm just getting some of the bits we need.
Okay.
All right for me to come through? Yes. Yeah? Is it all right for our medical student to come through as well?
Yeah.
Yeah, is that all right? Thank you. I'm just going to pop the light on.
Okay.
The first thing we do is just literally just check in and around the back passage, making sure there's nothing we can find there. So just checking the back passage. And actually, a bit of a skin tag just on the outside there. Try and relax as much as you can. Cold jelly. Big deep breaths for me, in and out through the mouth. Any pain at all?
No.
No, OK, good. Normal anal tone.
There is a little.
There is a bit of pain. I think that's probably where you've got a bit of a tear. Yeah, OK, that's fine. Checking for any blood. There's no blood on the gloved finger. OK, pop your clothes back on and come round. Since the initial constipation, how have your bowels been? Has the stool become
good? But
is the stool a bit softer or not quite?
it's a little bit softer. Yeah.
Fine. Okay.
Probably I didn't. Yeah.
So no piles. Nothing serious that I could feel internally. Nothing to find on the outside that's worrying me. It's definitely a tear, small anal tear that's been caused because of the hard stool that passed through, and you probably strained to pass that.
Right.
There is no treatment needed for this. It will just heal up by itself.
Slowly.
Most important thing is to give you advice about trying to keep the stool soft so that you're able to open the bowels without the pain and without straining. So things like pears, prunes, anything that's high in fibre, plenty of fluids as well. Those will all be quite useful moving forward to help the constipation. It should settle. I think it just needs a few more days. But of course, if you have any concerns, if the symptoms suddenly flare up, there's pain, then come back and see us.
All right. Okay.
All right?
Yeah. All right.
Thanks for coming in.
Sorry to bother you.
No, not at all.
I thought just double check.
Best to get it double checked. Yeah. Bye.
Thank you.
Morning. So we're doing dressing on your hand, is it?
Yeah.
Okay. So did you have surgery or?
I had an accident, or rather, an argument with a tractor.
Oh, right. You had an argument with the tractor. Right.
The tractor one.
So sit here for me. I want your arm there, please, or your. Yeah. Have they kept
my
you in?
wrist's completely destroyed.
Oh.
It's held together with pieces of metal.
Oh, right.
I've been going to the plastics dressings.
Okay.
Because there's a
Okay.
skin graft.
Right.
Basically along there. broken fingers.
Oh.
Broken fingers.
To knock
destroyed
together
wrist,
with that.
broken
Oh.
rib. broken neck.
Anything else? Oh dear. Okay. That is all dry. It's just area open here, isn't it? Can you see it here?
Yeah, I think that's where they were putting the...
All this looks quite nice. Healed, you see. Can you feel anything?
Not really.
Uh-oh.
Wrist is definitely stiff and painful at the moment.
You should cover with the painkillers because don't suffer with pain.
It's just uncomfortable rather than painful.
Okay. Now the iodine needs to heal this open wound, you see. You've got very much pain, so I want to be very, very gentle
That's
with
fine.
you. Then I shall bandage it, okay? Give me your left hand just on that little side. Okay?
Okay, thanking you.
No problem.
Okay, so another appointment for next week?
Shall we do Thursday again?
Thursday sounds fine.
All right, nice seeing you. Take care.
Thanks very much.
Bye-bye. Oh, solid sweetheart. This was a lot. Oh, God. I thought I was going to choke on that then. That's what. You okay? Yeah, I need a drink of water. I can feel it here.
What can I do for
The
you?
reason I've come over to you is I broke my finger.
Right.
It was very swollen, so I thought to myself I've dislocated my finger. Waited till the swelling went down.
Yeah.
So I came across
Were you
here.
trying to relocate
Yes,
it
because
yourself?
I've done it in myself once upon a time. So I thought, I can't do that. Now, the hand was fine,
Yep.
but it's swelling, and I am concerned about the swelling. It doesn't come out until the 14th June.
Okay.
I take the sternum pin out.
Yep.
Now, swelling there, and it's very sore here.
So you're feeling more pain now than you were feeling.
Yeah, and it burns. It gets very hot.
Yeah, and I suppose our worry is if you ever get some infection in there, that could be nasty. I've seen people with all sorts of pins sticking out of everywhere, really, with these sorts of things. But it's quite impressive, isn't it?
It's very, very impressive. Well, I can take this off when I'm sitting down to relax the hand.
Yeah.
But then I have to put that on when I'm in bed because you know how you turn in bed and you want, there's a hook. It's like a hook and it catches. Now, they give me an antibiotic because I'm allergic to penicillin.
Okay.
So the only one they had was terramycin. I was like a womble. I couldn't understand why I was feeling so giddy and really giddy and stupid.
Okay.
And I looked on I so happened to say to myself, well, read the leaflet.
Yeah.
And it said that it interferes with your blood pressure tablet, the amlodipine.
Okay, yeah. Whenever we prescribe antibiotics, we should really take a good look and see what other medications people are on, particularly because some antibiotics will cause problems with other medications that people are taking. In Mary's case, I think some of the antibiotics she was taking led to her blood pressure tablets becoming more effective and dropping her blood pressure. Should we try something else?
Yeah.
Let's go for old-fashioned erythromycin. Eh? You
Yeah.
need to be careful and see what
And-
it's like when you're taking it.
And
okay?
not take the statin when I'm taking the antibiotic.
Don't take the statin.
Thank you so much.
No trouble.
If I could kill myself, I would.
Yeah, look what happened last time.
What time are you on till? 6:30? 4:30? 5?
Mm-hmm.
Is that half day?
No, I've been here since 8:30.
I went to the one at 8 this morning and then here till 8.
Look at any easier. Stick that on
there.
Right, come and have a seat, Thelma. So, what are we doing today? Remind me.
Well, I'm terrified. You've got to give me an injection.
All right, lovely. So you're going for some surgery or other,
Yes,
are you?
Thursday.
What surgery are you going for, Thelma?
Ah, the worm again. So I keep bleeding, don't I?
And your chest is okay. Just so saying about your asthma review. Is your asthma all right?
Yeah, I seem okay with
Yeah.
the old breathing, yeah. I just felt a little bit tight.
Tight?
Yeah, because
Yeah.
I can't bear to wear a brassiere. I don't bra.
Mm.
Oh, look at me, brassiere.
Brassiere.
I don't remember the last time I said that.
Brassiere,
I'm thinking of my mother.
You're talking about
Yeah, bra.
girdles next.
Yeah,
Girdles and
I used to wear them as well when I was young and slim. I don't know why. I need one now. But yeah, I cannot bear to be restricted.
Yes, yeah.
I can't wear a bra or anything now as I'm getting bigger and older.
Good, good.
Definitely not.
Okay. Right. So what we normally do is give it in the stomach. Okay.
Yeah.
So we just pinch, jab.
that.
It's a bit stingy. It's a bit stingy.
Is it?
But it shouldn't be painful. Just a bit of a sting more than anything else.
I don't like injections. The worst one is when you do there on the finger. Sit on my own bloody doodah. Let's get some skin, shall I?
That's lovely. That's lovely. Well done.
Is that it?
Yeah, that's it. But as I said, because it.
Do you know how much I've been dreading this?
Because it
since
does the job.
Thursday?
Because
I swear. You're amazing. That is amazing. That's better than the INR.
But because it does the job that it's doing, you can get quite a dark sort of bruise
Doesn't
there
worry me.
afterwards. So that's done. Okay, lovely. So you've got those appointments booked. That's fine. Yeah. And yeah.
Is it you tomorrow, 12:10?
It is me again tomorrow.
It is. That's
okay.
lovely.
So,
You're an
yes. All right then. So you know not to worry next time.
I know. Well, I've got to run in it tomorrow. I won't have sleepless nights. You're an angel. Thank you.
All right then. Take care.
Good day.
Bye bye.
We said green was the colour green. Why can't it be diddly dabs?
Dibbly dabs.
Yeah, the colour diddly dabs.
Dibbly dab.
Yeah. Why can't that be a new Jimmy Flake, which is when I can't remember. Yeah. So why can't this be a donga? Yeah, and why can't that be a flower? Who thought of names for things? Come on, I want to know.
Come have a seat. Hi.
Talk about that throw last night and bloody hell.
Okay, so the amylase that we were testing, the normal range is about 28 to 100.
Amylase, what's an amylase?
So amylase is a marker that we use to see if there's problems with the pancreas.
All right.
Okay, and if it's under 100, then we're usually quite happy, and yours is 933.
Jesus.
Yeah, so if it's that high, we wonder whether the pancreas is inflamed, and that can be related to the alcohol as well. And it's the same message, really, isn't it? Because, I mean, I know when I first met you, you did really well because you got yourself down to about 6 cans, right?
Yeah, I went down to about 4.
But then I spoke to you, but then when I spoke to you in November, you were telling me about the same, right? You were telling me 4 to 6 at that time. So
Yeah.
I think you've done really well where you are, but I still think you need a bit of extra help. Hugh, I've seen quite a few times, and many of those times I've advised him to go to a specialist unit for his alcohol dependency. The reason for this is because he will get more intense support. It will be much safer for him because he'll get advice about how to reduce his alcohol safely and not too quickly, which can be a risk to his life. They're there to try and help you with practical ways to get you off. And if your head's in the right place, they also can arrange community detox. So that's where you go through a prescription to completely stop and be able to do that safely without then fitting.
See, I just, to be quite honest, doctor, I don't want to go in as somebody telling me what drinking does and what drinking does, you know what I mean? I feel that I can do it. I don't need it. I feel I can do without it.
He needs to make that choice. So it's often our frustration is that we will make recommendations to patients like you, but not until they're ready will they actually go. You know, your situation is that you don't have much choice really in that sense, because the risks to your health and your life really, because you're at that stage where we know you've got cirrhosis. We can see from your blood test that your liver's really stressed, really stressed with this. Physically, your body's saying we need to get to a stage where you stop. So the bottom line is we've got to address it. Where you are at the moment, you couldn't just stop like that because you'd be at risk of fitting and that could, risk of death, right? And I don't want you to do it unsafely. I don't want you to walk out here and then just stop completely and then, could go through the shakes and have fits and stuff, because that's a risk as well. It is possible to die from the withdrawal effects of alcohol, especially if you're a dependent alcoholic. If you're a heroin addict and you have a withdrawal, you won't die. Whereas if you're an alcohol-dependent patient and you withdraw just like that, then there's a risk to your life. They might have an alcohol withdrawal seizure, and as a result of that, they could swallow their tongue and be unable to breathe and then die.
And you haven't forgot about this, doctor?
Can I have a look? But you know what, we could probably do it today if you want.
Yeah.
All right, and then we'll get you up here. All right, so you're just going to feel a sharp scratch coming now, okay? Just want you to stay nice and still for me. All right, that's the worst bit.
Okay.
You feel anything sharp there? No?
No. Bleeding a bit, yeah?
Yeah. It's because it affects the liver, makes clotting factors to help clot. When I removed Hugh's wart, it bled a lot because of his chronic liver disease. It's bleeding away on us. Yeah. His liver doesn't produce the clotting factors that you need to be able to stop a bleed from happening. I think we might need a gauze to start off with.
I think it's coming down by the eyebrow.
Yeah, it is. Any time that you might have a cut or an injury where you might bleed, whether it's internally or externally, you have these clotting factors that will stop that bleed from becoming life-threatening, whereas a patient with liver disease doesn't have that ability anymore.
It's like cauterizing it, or...
Yeah, effectively, yeah. All right, round 2. As long as we don't get any blood on your shirt or your jumper, we'll call it a success, shall we?
Don't worry about that.
You okay?
Yeah.
You're slowly winning. Well, that was a lot harder than I was expecting when we started.
Should have been 2-minute job.
Yeah. We spent more time on this than we talked about the really important stuff, isn't it?
Yeah.
Cheer up, ladies, ain't that bad.
How are you?
Not too well, I need your help.
Just take a seat. And what can I do for you?
Right, I'm experiencing bad heads, dizziness, the pain in the head. It's like, have you ever bitten on an ice lolly?
Yes.
Right, well, that's how I describe it.
So when you say dizziness, do you mean the room spinning round?
Not exactly. And when it's bad, Doctor, I have to describe it like this, is when I'm drunk. Well, I've never. I don't.
But you feel?
I have been in my young... But that's how to describe it.
Is it there all the time?
At the moment, yes.
And so, say if you're sitting down and you turn your head or look up.
Then, yeah.
That, okay. All right. Good, that's fine. And you have a discomfort behind your eyes as well?
Yeah, behind the eyes. There. Yes, you got it. Oh, dear, yeah.
Sorry, yeah. Is it tender if I press there?
At the back.
What about here?
Not so bad.
How's that? Bit uncomfortable?
Yes, yeah. Oh, dear. What is the matter with me?
Well, wait until I finished, yeah. Right. Just look at my finger and just follow my finger across. Good. Just follow it up. Down. Good. Now, I think this is crystals in the wrong place in your inner ear. And you don't know where you are, so you'll feel unsteady. Now, what we've got to do is we've got to manipulate your head and your neck so that the crystals get back into the right place. You're the last patient I have, so I can spend that time with you if you wish.
I do wish.
Okay, good, okay. So, what you need to do, you want to put your bottom there. So you're sitting up straight, okay? But just come right back with me now. That's right. So what I want you now is turn on your left side. I'm going to hold on to your head. You've got to move your body round to the left side. Look at my forehead. Keep looking at my forehead. That's right. Good. Good. Well done. And I'm going to hold this here for about 30 seconds, okay? And then we'll just do it once more, okay? How are you feeling now? How's your dizziness? I'm just going to move. Good. So just sit up for me now. Just take your time. Good. How are you feeling?
Oh, yeah.
Feeling a bit better?
Yeah, you're just...
Is it amazing?
It is.
It is, yeah, yeah. That's called the Epley maneuver, okay? Just stay there for a few minutes, just recovering from that, okay?
Yeah.
Good. So, come down. Good. So that's all we need to do.
Okay.
And then you tell me in the next 3 or 4 days how you feel. And if it comes back, let me know and we'll repeat it again.
Thanks for seeing me.
That's so nice to see you. Yeah. You take care. Bye.
Thank you very much.
Okay. All right. Bye.
Take care, and I'll see you in a few weeks, yes?
Thank you so much.
Okay, see you later.
Bye.
Bye-bye.
Thank you.
Farnham Surgery, Pam, how can I help?
Hello, darling. Come in.
Thank you.
You saw Dr. Bolger, didn't you?
did,
Yeah.
yeah.
And she's put on here we need to repeat your liver function.
This is the best one.
That's good. Oh, yeah. It's a whopper.
Yeah.
I like that.
As long as you leave me some.
Has nobody seen this yet? Has anyone seen it? No.
No. It doesn't bother me, except if I touch it there, which is the point of contact with the floor.
Yeah. I don't check the faces, but I'd be inclined to put you in to see the emergency doctor this morning.
Maybe you'd better check it out.
I would prefer to, have the doctor have a look.
Okay.
Right, my darling. Nice straight arm.
No, he's parked right in the middle of the car park. I couldn't get into any of the spaces.
Oh.
He won't move because he's waiting to pick
What, in here?
up in the doctor's car park.
Oh.
Ah! Come on in, Sarah. I'm Dr. Bolger. We've met, I think, haven't we? Okay, so how you doing?
Levels are still everywhere.
Right, because we... have you had bloods done or not? Here?
Not recently.
No, the last one we've got is horrible, but it's a long time out of date. You're due some more, aren't you?
I think so, yeah.
Yeah, okay. And they are everywhere, aren't they? So there's loads of 20s, yeah? There's no lows that I can see there. Are you having any hypos?
I had one just before I come.
Today?
Yeah.
Right. Are these any better than they've been?
It's everywhere still.
Okay. You know that I need the diabetic specialist to have a look at you for this, yeah?
Yeah.
And we need them to see you sooner rather than later, don't we? Tell me how much insulin you take.
Well, I take 11 minutes in the morning, and then I have between 18 or 24 or 26 of the Humalog with the 11 in the morning.
And then at lunch?
It's about 24, 28. I put it up to 28 lately.
And what about your evening meal? Is that your big meal of the day?
Yeah, if I have that, I take about 30 of that.
Are you not eating regularly?
No, I've gone off my food for about 3 months now.
Do you know why?
I'm suffering from depression as well.
Come on through. How can I help?
Well, I fell and down my...
Yes.
Everybody says I have to have it checked out to see.
When did you fall?
On Saturday.
Saturday. What happens?
Well, I was coming down the escalator in the shop.
Yes.
With a trolley to turn it round. Of course, the escalator doesn't stop.
Of course.
It keeps going.
Yeah.
Taking me with it.
Oh, bless you.
And I couldn't stop myself.
Is it painful?
It's only if I touch it. It's not that painful now.
Yeah.
You know, the pain dies down. But I saw a chiropractor yesterday because I see them for my arthritis. And then I saw the nurse this morning to give my blood sample, and she said, I think you should have that.
Oh, all right.
So they
enough.
both said, have it
Have a
looked
little
at.
look. 'Cause you're on aspirin, aren't you?
Yeah, that's why I'm
That's
all
sore?
black and blue. Yes.
A bit sore there.
Yeah.
There's no bleeding from the nose or ears or
No,
anything,
no.
Good.
Ow. See that? I think it's the cheekbone.
Yeah.
Actually, it's probably bruised. You know, something like that.
It's all bruised around here.
Yeah.
Bless
No,
you.
doesn't look awful. And it will take ages to get better.
A few weeks.
I know
yeah.
it will.
You didn't lose consciousness when you fell.
Oh no, no.
Other side. Okay. Good. I think it's just badly bruised.
Do you think so?
Yeah, I don't think you've broken anything.
No, that's what.
But because you're on aspirin, it does make you bruise more
Bruise
easily.
easily,
Yeah.
Spoiled my beauty completely.
Oh, I know, you poor thing.
I think I had bad enough to start with.
It will get better. We just got to be patient.
Eventually, yes. Anyway, I'm sorry to take up your
No,
time,
no,
but it
not at
wasn't
all.
my fault.
Better safe than sorry, though.
Well, I suppose so, yeah. Anyway, thank you very much.
That's all right. Take the lift, okay?
Okay.
Don't want you falling down the stairs now.
Bye-bye then.
Bye.
You look like you're dead, Mum.
Huh?
You look like you're dead.
I'm really tired. I'm really tired. I was in bed at 9 o'clock last night reading my book, and then Dad drank a full bottle of wine, which made me cross. He then fell asleep, missed the football, and it was my favourite that I'd had half a glass out of, so now there is none of my favourite. It's beautiful, beautiful Shiraz, and then I went down to get a glass and he drank it all, and that was half past 10. No, I told him to stay downstairs because I wasn't putting up with nonsense snoring, but he came to bed, so I went to bed in a mood.
What are they doing about your depression?
I'm on 40 mg of citalopram at the minute.
Have you had any talking therapy?
Not yet.
Would you like to? Is there anything going on that you need to talk?
No, I'm just not motivated to do anything. I don't know what's in particular.
So there's nothing particularly worrying you? Would you like to talk to anyone about the diabetes? Because that can be tough living with a long-term illness, can't it?
Not really, I'm just fed up of it being high, but I guess everyone gets fed up.
Some people find the confines and the complications of something like diabetes very difficult to deal with. It's a lifelong diagnosis and it affects nearly every aspect of your life. Having a chronic condition makes you depressed, and being depressed makes managing a chronic condition much more difficult, and the two are very definitely linked. I'm going to send you back to the diabetic clinic. There's blood tests on the system. Will you book them for me? Yeah? Here. Yeah. In fact, let's get you a blood test now, and then I can send you back to them when I've got the new results. Yeah? If you change your mind about talking to someone, if you change your mind about talking to anyone around the diabetes, you get a message to me. Are you seeing anyone again about the citalopram?
Not that I know of.
What about hurting yourself?
No. I had a hypo fit at the end of March.
Sarah had several admissions which have been directly related to her uncontrolled diabetes. Hypo is when your blood sugar drops. So if you think about when you feel really hungry, that horrible empty feeling, but magnify it so people feel trembly, shaky, sweaty, often become confused. In its most extreme forms, hypoglycemia will lead to coma and, if untreated, to death.
I don't have the intention to hurt myself, but if something like that happens, so take its course, basically.
That sounds horrible. You've been diabetic long enough to know that if you're not looking after yourself properly, then you are at risk of hurting yourself, aren't you?
Not being noticed, but I'm forcing myself to eat now.
Not taking control of diabetes, not managing your diet, it's self-harm by neglect. So diabetics who are struggling with motivation will often say that they wouldn't deliberately do anything to hurt themselves, but sometimes they really just can't be bothered, and they're aware that that will then have an impact on their health. What should we do next? What could we do next to help with that? Why not talk to someone?
Not really anything to talk about except for fed up.
You think it's tied into diabetes? Might be an element of chicken and egg, mightn't there? You're feeling rubbish, so it's hard for you to keep on top of your diabetes. Your diabetes is rubbish, so that makes you feel depressed. When you come back and see me after those blood tests, and you stay on the citalopram until then. And if you change your mind about talking to someone, will you let me know? You don't have to wait for the appointment to do that.
Okay. Just phone up and say, can I make an appointment with Dr. Bolt?
Yeah, just phone up and say, I'd like Dr. Gordon to give me a ring. And we crack on and we get the diabetic people to see you and try and bring your sugar down. Does that sound like a reasonable plan? I will expect to see you in a couple of weeks, yeah?
Yeah, that's easy.
Bye-bye.
Can someone grab me some paper towels? Lady's collapsed in the street. Sheila's with her. I think they're going to be okay. They're going to bring her in. Thank you. Thank you.
Hello, how are you today? I understand you had a panic attack in the workplace, is that right?
I was on my way to work.
Oh, okay.
I don't know what happened. I was fine in the morning. Dropped my kids off as per normal. I was driving. I started to feel my legs just started shaking. Hot and cold flushes. I could feel my just chest and everything just burning up. And then my hands just started to freeze. I couldn't change a gear, so I just pulled up. And then I called my manager, who then, while I was on the phone, I was sick, and then she just called the ambulance. But they've given this now.
Let's have a look. How are you feeling now?
Still on and off. Like, I'm getting hot flushes. I can feel like just steam coming out of me.
Yeah. So you think this is probably panic attack? Yeah.
I don't know. Maybe, I don't know.
Let's check, give a few checks today. Check your temperature, listen to your chest, and look at your throat and see what's going on. And take it further from there. It's going to... No, you don't. It's not panic attack. It's your temperature, 38.2. So that's why you're shivering and feeling very cold and hot and sweaty.
Right.
It's a big I don't tend to use this, but I may need to because you're not opening your mouth big. Say big Okay, that's good. Quick, listen to your chest. Thank you. Oh. The chest is all below clear, and the upper areas, there's some harsh breath sounds. You're coming down with a viral illness, and that's why you're feeling this way. The throat can become much more sore and dry, and you'll have mucus coating as hours pass by, and you feel a lot more unwell as well. So start taking Nurofen and paracetamol. Drink plenty of fluids and take good rest at home. There's nothing else sinister or serious going on as such. Yeah, and it's not panic attack or anxiety attack.
Okay.
Is that okay?
That's fine.
Yeah, you're feeling miserable and awful, but hopefully things will get better. Okay?
Thank you.
All the best now. Take care.
Hello, Dr. Morris. Thanks for waiting. How can I help?
I've got two things
Uh-huh.
in my foot. I've used the wart cream as well.
Yeah, okay.
And
Yes.
this one is quite
Yeah.
painful
Yeah.
as well. And same as this one.
Okay. The treatment for this is to buy something called duct tape. or duct tape, and you put it on, cut a little piece off, put it over it, leave it on, and usually within 2 to 3 weeks they go away, and it's twice as good as the stuff from the chemist or freezing or anything else.
And I can find it on...
So, okay, good question. So a hardware store, places like, B&Q, Wickes, those sorts of places. You need a smear. You know a smear? Yeah, that's what it's saying, you need a smear.
It's been 5 years now.
Well, it's every 3 years you need it.
Is it?
Yeah. If you can make your point on the way out, that'd be great. For that. Okay. Sorry. It's best to have one, though.
Thank you very much.
Okay. Bye-bye.
Hello, sorry to keep you waiting, my lovely. How can I help?
Good afternoon. Come and have a seat, sir. Hello. So, how are you today? How can I help you?
My little boy, he got a white spot in his pupil, a left eye. He had been checked. We went to the Oxford Eye Hospital. He sent the fax over here and the post as well. So we want to discuss with you.
So it's on the left that you're noticing?
Yeah, left, yeah.
Yeah, I think that's it. It might, but not necessarily be that you can get something called a congenital cataracts.
All right.
So they get like a whiteness, which I think is what you're seeing. So I'm going to write a referral.
Oh, all
so
right.
you should get something in the post.
Okay,
From the eye specialist, yeah.
Basically, looking at this, it's not just the cataract. Behind there is blood vessel formation and hence not a completely developed eye. And nothing sinister or cancerous, but he has advised against having a surgery. But I totally understand your concerns about whether there will be somebody out there else who could give a different opinion for a different, better prognosis and outcome.
Yeah.
Initially, what he says is that by doing surgery, there is a risk of the back of the eye retina to detach, and that causes blindness.
Oh dear. In we come. In we come. No John today? Have you got your new teeth?
Yes.
God, they're much better than the old ones.
I know they are.
You look great. Are you happy?
Yes.
I think they're great. Oh, that's very
Thank
kind
you.
of you. That's very kind of you. Let me get this chair out. I've known Peggy for probably 17 years. As soon as I started the practice, I got to meet her. She suffers badly from quite extreme osteoarthritis, which has affected most of her joints over the years, particularly her back. And when I started doing acupuncture as a treatment, then she seemed to be a perfect client for this type of treatment.
Before you start sticking me, this calf has really been hot and swollen.
Yeah?
And but I don't know whether I've overdone the gardening or what I've done.
How long for?
Well, it's just about cooling off now.
Okay, when do you mean by that? Do you mean for the last...
4 days.
Right.
And I haven't been able to do a lot with it.
You can't remember doing anything to it, though?
No, oh, definitely not.
No.
I've been doing a lot of gardening. I'm just wondering whether I...
You didn't feel a pull or a snap or anything like that? So I've been using acupuncture now for about 15 years. I attended a course and was a little sceptical after coming out, but I gradually introduced it to my surgeries, and over the years have found that 70 to 80% of people get some effect from the treatment that we give them. If you can cut down on medication, if you can reduce their pain levels, then I feel that it's a successful treatment. God, and the hair's been done as well, hasn't it?
Yes. Very noticeable today, aren't you, David?
It's not routinely used under the NHS unless you go into a specialist pain clinic or physiotherapist normally. In fact, I think there's only 2 of us in Slough who offer acupuncture as a service, and we do it off our own bat. Okay, let's have a look. Okay, so nice and relaxed, just let everything flop.
See, that hurts. That really hurts.
So all over if I
yes,
do that, yeah.
Yes.
Any specific point or not?
All
Just
that.
all of it?
All that.
All of it, all the way up and down?
Yes. Yes.
Okay, that's your muscle, isn't it? That's...
Is it? I want to talk about my toes. That one there now,
Yeah,
that's coming over here.
the overriding one, yeah.
And this one is coming over.
Okay.
Like that. So do I have to phone up and speak to him, or do you have to?
I'd have
refer
to refer you.
me? Yeah.
I mean, the problem with that one is that you've still got a bunion of sorts here. Do you know what
Well,
I
haven't
mean?
had that done, have I?
Exactly. So it's in that direction. So this is a reasonably straight toe, but it's
Yeah.
this one's popping underneath it,
Yeah.
whereas that is just the most disastrous looking toe I've ever seen. Well, it takes a 90-degree turn, doesn't it?
Yeah, it
there.
does.
So
Yeah,
it's
yeah.
so that's very different. So that would be to do something with that joint.
Yeah. I'm quite happy to have it done.
Whereas that one would be, I would be tempted not to do anything with that.
Okay.
Okay, because I think that would involve having to do this whole foot.
Yeah, and I don't want that done before I go away.
But that I think probably needs to. Is it causing pain?
Yes, and especially when I've got shoes, and I can't back to square one again. I can't
Yeah.
even have proper shoes on.
All right, madame. What have we got? These sticking out here, 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 here.
So I'll see about 5 to 6 weeks.
Yeah, I will. So we'll send that off to you, and we'll get you back in
You're
again.
after the-
Yeah. Look, let me help you. Well, what you're doing.
Thank you.
You haven't had a gin today, have you already?
No.
No. Okay.
Okay then, David. Have a lovely holiday.
I will.
Look after yourself over there, please.
I will.
If we don't operate, he might be left with a reduced vision.
So
on
that
the
means he
left
still can
side.
see.
He can still see. Right side is absolutely normal.
Yeah, I know.
People can function with one eye, but obviously, as a child, you need to want to make sure everything is perfect with your little one. Patients rarely ask for a second opinion. They usually trust the judgment of the doctors. In the John Ratcliffe Hospital, the consultant discussed with the parents the pros and cons of doing a surgery to restore the vision. The parents were told that by doing a surgery, there is a likelihood of blindness. Because of that guarded prognosis, the specialist told the parents that not doing an operation might help the little one. Hence, the parents came to see me for a second opinion. Yeah. If you do the operation on such a small eye now, there is always a complication of bleeding and the retinal detachment, and that causes complete blindness. So, whenever the surgeon is putting his scalpel or procedure anywhere, he weighs the options, benefits versus risks. Based on that, they give the advice. But there's no harm in getting a second opinion. Yeah. Parents are always anxious about and want to get the best outcomes for their children. As a parent myself, I feel the same. Getting a second opinion gives the patients extra element of reassurance. If I put myself in their shoes, I would think it's perfectly harmless to try doing that, because following the first opinion may not achieve the best outcomes for them. Hi, this is Dr. Nanda dictating a referral letter to consultant ophthalmologist in Great Ormond Street Hospital, London. The assessment and the first opinion is very detailed and clear. However, the parents are looking for further second opinion with a view for enhancing the overall outcome for the left eye for this little one, and hence this referral sincerely. Okay? So this will go, and the secretaries in the next 1 or 2 days will fax it across to the Great Ormond Street Hospital, and you should be getting a letter in the post within the next week or two. And I'll contact you on Friday after speaking to the Great Ormond Street Hospital as well. Is that okay?
Yeah, that's fine.
All the best for your little one, okay?
All right. Thanks a lot for your help.
Not a problem. Take care. Okay.
Yeah, thank you.
All the best.
How long have you suffered with psoriasis?
Quite a long time.
Okay.
But it's never actually been that bad before.
Where does it affect you normally?
It normally just affects me here, but now it's started showing up here.
Yeah.
Started showing up on my other arm.
So you've got it on your trunk, you've got it on your elbows, I can see. Have you got any sort of in your groin area, genital area?
No.
No? Any in your belly button?
No.
No? Okay. Your ears are okay?
Yeah.
Hair or scalp? Any problems with that?
No.
No? Okay, good. How do you normally manage this?
Well, I've been using creams in the past that just ain't helping no more.
So there are some other things we could try which you've never had before. So one of them is something called Dovabet gel. Does that ring a bell?
No.
So I will give you something that will help to try and accelerate the clearance of this. But it is still important you use a regular moisturiser to soften the skin. Because it's what psoriasis is over thickening of the skin. It's sort of almost you could call it a defect. It's almost healing and thickening up too quickly. Usually if you do that once at night before you go to bed, that should be enough. But then you need to look into moisturising straight after doing that. Have you used Vaseline, that kind of consistency on your skin? An ointment?
A lot of Vaseline contains like nuts and stuff, and I'm allergic.
Okay.
So I don't want to be rubbing that on my skin and having an allergic reaction.
Vaseline doesn't contain nuts. It's a petroleum jelly. Have you used it before and had a reaction? It's basically an oil-based product as opposed to...
There's like lots of different Vaselines. Like
Okay, so what I'll do, I will give you two things that I think will be best for you to try. If it works, then it's great. All right? And then I'll need to see you back to see if you're agreeing with it in terms of it's suiting you or it's making a difference.
All right.
Shall we do that?
Yeah.
Okay, see you soon.
Hello, darling.
At 8:40 with the nurse.
Right. Blood test or...
Blood test.
Hi, June. It's not. It's not a permanent move. It's just for this morning. So is it better for you being this close?
Well, for me it will be, but I mean, I'm just one.
Right.
I'm staying here.
Okay.
This is the appointment you told me not to cancel.
Good.
I am slightly worried about my theophylline level, having been told it's gone over 20. And my shakes are getting pretty every day.
June's main problem is chronic obstructive pulmonary disease, COPD, and the problem is given her over the years has been progressive shortness of breath to the extent that this now is limiting her life. June is on quite a lot of medication. Theophylline has an anti-inflammatory effect to open up your airways, help you breathe a bit better, and also an effect to relax the muscles that we've got in the bigger airways in the chest and in the bronchioles. The problem with this is that if you give someone too much of it, you get too much of the effects. So your blood pressure goes up too much, your heart beats too fast, and you start to feel really quite unwell. Do you think the shakes are caused by the theophylline level being high?
Well, I take my tablets at 8 o'clock. The shakes start. It's like a caffeine rush, you know, when you're shaking inside.
Yeah.
And I've noticed recently, which is unusual, that after I take the theophylline at 8 o'clock at night, for about an hour I get slight shakes again.
How's the breathing been?
It's not as good as it was. I mean, at this time, with this steroid course, it's gotten a lot better. I don't know if it's just me, but I think it's beginning to creep into getting worse again.
What would you like to do about the theophylline level?
I'm in your hands on that one. I know it's a dangerous drug.
It comes down to the fact you are having side effects. Would you like to...
I'm capable of putting up with these side effects until I finish my steroids and see how we go on that one.
Right. So that brings on the issue about tapering off the steroids. We often use steroids for conditions in which we want to damp down a patient's inflammatory response, such as eczema or asthma or chronic obstructive pulmonary disease. Steroids really useful drugs when used properly in the right dose. We do worry about patients who have higher doses for longer periods of time because that's when you then start to have the side effects from them. So what do you want to do about that this time?
I really don't know. I haven't got a clue. I cannot cope with not being able to breathe, to look after myself.
I can only imagine how bad that must be.
Because what I find at the moment with the steroids, it gives me the get up and go before it affects my breathing getting better. As my breathing, shortness of breath gets worse, my get up and go disappears out the bloody window. The fact that I can cope with it goes out the window. It's a bit of a vicious circle.
Are you still having pain now?
No, it's eased off now.
It's
I
eased
say
off
that's
now.
why that pain was. So I've not had it for about maybe 4 or 5 years. That sort of pain.
Really? So it's more severe than usual?
Normally it just goes, and I take my spray and it's gone.
What time roughly did it happen then?
I would say about 5 to 3.
5 to 3, okay, fairly recently. Yeah, okay.
I phoned the hospital.
And prior to that, you said you don't normally get pain this severe.
No.
How often does your angina pain normally affect you, though? Is it something that do you normally have to use your spray
Yes,
most weeks?
normally I have to use my spray. I go through quite a bit. Because I'm
Right.
waiting to see the heart specialist.
Okay, fine. Apart from your inhaler and your usual medications, have you taken anything else today?
No, the only other new medication I have been taking is I was on citalopram, 40 milligrams.
And this pain, when you had it, did it move up to your neck or down your arm, or did
No,
it?
my arm went stiff. I know that. It
went stiff.
It happens quite often that way. That's why I took my pressure.
Okay.
Straight away.
So listen, what I'd like to do is do your blood pressure.
Right.
Have a listen to your heart.
Yes.
But I think what we also ought to do is get an ECG done. Yeah, you know what they are?
Yes,
the
I've had it
stickers,
lately.
yeah. So one of my colleagues down the corridor will do that in a second. Let's examine you first, okay?
I really thought I was going to black out. That's how bad it got.
Really?
A double vision. That's not bad for me.
I mean, that's good.
Yeah.
But I'm still a bit worried.
Yeah, I know that.
Okay.
I'm very
Especially because
worried.
you know in yourself what is a normal angina pain, and for you this was severe, wasn't it?
This is severe.
And it sounds like it's been happening fairly often recently as well. I think today we need to do a blood test in hospital.
In hospital?
Yeah. So there is a blood test that we can sometimes do called a troponin, because sometimes you can get things can become unstable, and I really don't want you to have a more major episode than this weekend. Okay. So let's get an ECG done, and then we can have a chat about giving the hospital a call and getting you seen there today.
Okay.
Yeah?
Yes, sir.
Okay. So if you just stay here for a second, I'll just confirm which room's free to have it done. All right? Thank you.
Thank you.
All right, let's have a look at this. So, looking at your ECG, I think we still need you to be seen in hospital today, okay? So what I'm going to do is call Wexham Park, let them know your story and what's happened today. Okay. Hi, it's one of the local GP registrars in Farnham Road Surgery in Slough. Hi, I've got a gentleman with me who had a particularly severe episode of angina this afternoon. He is known to have ischemic heart disease, but this was a particularly severe episode for him and more prolonged than usual. So I think really he probably needs to come in and have a troponin and a repeat ECG. Okay. Thank you. Bye. I'm going to give you a letter to take with you as well.
Thank you. Okay.
Okay?
Thank you for all your
I
help.
wish you all the best.
Thank you very much.
All right.
For all your help. Thank
No
you.
problem. Take care.
If you wanted an ambulance for cardiac arrest, which this is, here from the surgery, what's the number you're going to dial? You need 9 for an outside line, then it's 999. In the heat of the moment, people forget things. Different places may need 9 for an outside line, some places don't. Let's do compression then. One hand, centre of the chest, other hand on top. Get yourself comfortable. Go for it.
It's a bit of a vicious circle.
And is your breathing okay at the moment on the floor?
Yes, it's okay at the moment, and I'm coping. And then you keep finding things.
Yes.
It's not helping.
Not helping, yes. Maybe we should just stop looking.
I think you should. I keep telling you this.
Yeah. Patient's always right. You should listen to you, yeah.
I've got to last until my Charlie gets through medical school and graduates.
Okay, when's that going to be?
And at least one of my grandchildren gets married.
So what are we talking about? 10 years?
Yeah.
Okay. 10 good years, not 10 years of being looked after, but...
No nursing homes whatsoever.
Mm-hmm.
I'd rather die than go in them. So, yeah, quality of life.
Right, okay. So the plan, then, is... For the moment, let's keep on the same dose of theophylline and just see how you are with the side effects, and we'll repeat the blood test and make sure it's not creeping up. Do you want to come back next week and see how you are and discuss it again?
I think, to be honest, that's too soon.
Okay, 2 weeks.
Yeah.
Okay. Is there any chance you can actually read my doctor's writing there?
What the hell did they say about you at school?
Yeah, but that is my absolute best.
God almighty. Do they teach you to write badly?
There's 3 reasons why doctors write badly. Number 1, we rush. Number 2, we can't spell the medical words we're writing. And number 3, if you can't read what we've written, we can always say it's something else we wrote. Yeah, that's why it's all typed now, so you can't deny what we've written. And it corrects the spelling for us.
Right.
Okay, nice to see you. See you 2 weeks' time. I hope things settle down for you.
Okay.
Peanuts. Okay, take care. Bye-bye.
Bye.
Hi, you're all right. Is it right to put this down?
Yeah, completely. That's fine. I'll have a seat.
Just basically, I just booked this appointment because I had it's called medical yesterday at work.
Okay.
And come out on my hearing test was pretty bad, and they said maybe we should come in and advise with a GP. I thought come and get it out of the way.
Okay.
It looked scary. Basically, I just looked at this in category 3, and I was just like, well, that must be bad.
Okay.
And obviously, I have a few people at home, your hearing's not so good. They're always telling me
Yeah.
maybe I should do something about it, kind of thing.
Okay, so how long have you noticed that it's not been so great?
I ain't really noticed.
Okay.
It's everyone else. that
So you don't
notices
have a
it.
problem?
I don't really have a problem.
Okay.
It's just sometimes I do struggle to hear certain distances and stuff like that, but it ain't really bothered me up until the point of having this check, really.
And have you had any problems with your ears earlier on in life?
No, but my family have.
Hearing loss can be hereditary or it can be acquired. That's why it's important to ask about a family history, as families have many things in common, such as genes, their environment and their lifestyle.
My brother, he's had his grommets done, and my dad's got bad hearing, my sister's got a hearing aid as well.
Okay.
So, yeah.
Fine. Okay, so I'm going to have to take a look inside your ears.
Yeah.
So what job do you do?
I'm a binman.
Okay. You are at higher risk of developing hearing loss if you work with noisy equipment. This is known as noise-induced hearing loss and occurs when there's damage to the sensitive hairs which lie within the ears. Just have a look in one, sorry. There's definitely no wax in there. Sometimes that can cause a problem.
That's what I originally thought the problem was.
Yeah, and I can see down to the eardrum.
Right.
And they both look okay. So I don't know what's going on. So what I'll have to do is I'll have to refer you to the ENT specialist for them to investigate this further and see what's causing it. Okay.
Yeah, that's fine.
All right.
Will I get a letter or...?
You'll hear from them directly. Okay. So anything between 6 to 12 weeks.
Yeah, I appreciate that. Thank you very much.
Okay.
Happy everything, yeah?
Yeah, that's fine. Take care.
Lovely.
Bye-bye.
Cheers.
Bye. Bye. See you later.
Thank you very much, Doctor.
Bye-bye.
All right, thanks. See you, mate. You take care.
No problem.
Bye-bye.